seek to provide expert advice for various issues connected with skin and hair care. Our skin and our hair is a crowning glory and it makes a world of difference to our appearance. However, our skin and hair also require special care and attention. Most of the skin problems, if identified early, can be managed well, and much of the problems can be avoided and can be managed by modifying to fixing our faulty lifestyle. Today, we have with us Dr. Vishal Agrawal, is a well-known doctor who specializes in dermatology. He's MBBS and MD in dermatology, venereology, and leprosy. He is currently working as consultant dermatologist at VISH Skin Clinic, GURUGRAM, Delhi. Dr. Vishal Agrawal has dedicated his career to diagnosing and treating a wide range of skin conditions while providing specialized healthcare services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Thank you, Dr. Vishal Agrawal, for sparing your valuable time to answer a few questions on skincare for us today.
Hi, thank you, Mona. Good morning.
Good morning, doctor. Thank you, doctor. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, doctor, today we are going to discuss know your acne. So, when we talk about acne, it is a problem which is like faced by all of us, irrespective of age. So, the first question which come up to our mind, like. Does the food habits like what to eat and not to eat by acne prone people or patient, is there any diet guidelines?
Correct. Diet is very, very important for acne, at least since teenage. So girls, especially after 13 to 16 years of age, and boys, yes, from 15 to 18 years age, they start getting acne. And that is the most important age when you should know what to eat and what not to eat. So ideally, dairy products, there are like very few dairy products which do cause acne. So once you start eating those, you will come to know that yes, you are getting acne. And sugars and processed food, cheese, paneer, chocolates, fried food. So all these, diet is very, very important. Along with diet, I think hormones also play a big role. So in males with hyperandrogenism, so they get multiple acnes. Females, yes, PCODs, polycystic diseases, so they cause a lot of acne. And other than diet, makeup, I think makeup is also important. So cosmetics, what cosmetics you are using, whether it is medicated or non-medicated.
Okay, doctor. Doctor, like as you said that the diet is important for healthy skin. So is there like nowadays like our lifestyle is like sedentary. So is it like sedentary lifestyle also play a role in acne or development of acne, like not exercising, sleeping late, and eating anything?
Yeah, correct. The sedentary lifestyle does play a role. People with it has been observed that people with no exercise at all, so the sebum production is more in those people. So basically, oil producing, and it does block the glands, and blocking the glands will definitely cause acne. So yes, workout is important. So some exercise should be there, at least maybe 10 to 20 minutes or 30 minutes, depends on everyone.
Okay, so not only for a good healthy body, or also skin, we need to exercise.
Yes, correct.
Okay, doctor. So, doctor, like, is there any alarm sign like for acne also, like when to visit the dermatologist by acne patient?
Okay. This is like some people do manage it with home remedies and they get good results. So yes, definitely, if someone is getting acne, so they are going to try it themselves only. Not everyone goes directly to the doctor, but ideally, yes, if you are getting multiple acne, more than 3 4 per month, I would say, because in girls especially premenstrual flare is there. So premenstrual flare is very normal. Everyone gets it. 2 or 3 acne is very normal. So more than that, if you are getting, definitely you should visit a dermatologist. In males, also same scenario. Males do have much more oily skin than females, so they get much more acne. So definitely to prevent scarring, you should visit a dermatologist and start the treatment as soon as possible.
Okay, doctor. So whenever we get more than 2 to 3, 4 or something abnormal on our skin, we should visit to the doctor instead of just, using the home care products.
Correct. A correct face wash and a correct moisturizer will do the job. But yeah, with most of the people, it is not possible. So
Okay.
they have to.
Okay. Very informative, doctor. So, what one can do to prevent, one problem is that we get acne and we, touch with our fingers, hand, and we make a scar on our face. And the people who are prone to acne, they have a lot of scars. So, how do we prevent acne scar by acne patients?
Acha, why does acne scars occur? This
Uh,
question is being asked by like many of my patients. Why
mm,
does it happen, doctor? So my reply to that is, if you let the acne for much more period on your face, it's going to cause scarring. So the key is to treat the acne. When you get the acne, treat it as soon as possible. So just to prevent the scarring, because once acne is there, especially nodulocystic acne, so there's very severe type of acne. So in that, the size of the acne is almost like double, triple of the what normal comedones have. So those type of acne does cause scarring, and it is really traumatic in young population.
okay, doctor. So, pre-management of acne is important to prevent the scarring.
Prevent the scarring, correct.
And what about those people who already there are people who don't go to the doctor, don't take the timely precautions. So if they get the scar, is there any solution for them also to prevent the scar, like to get rid of those scars?
So scars is something pathology much beneath the skin. So to treat that, medications don't help much. So there are much advanced devices. Let's talk about fractional devices. There used to be fractional. There was derma roller devices first invented to treat the scars, and then comes microneedling, which is a much advanced device. So microneedling, MNRF, it's called microneedling radio frequency. Then erbium YAG lasers are also there, which much higher wavelength 2970. So yeah, these are like few of the devices which do help for acne scars, but depends on patients to patients how much improvement they get. Sessions are also required, not like single session you can treat the acne scars. So yeah, definitely 4 to 5 sessions of a good laser devices or RF devices will give you very good results.
Okay, so it's not late for those who already are facing acne scar. We still have the treatment available to get us clear skin.
There's the treatment. Yeah.
Okay, doctor, very informative. So, doctor, can acne patient use makeup?
Mona, see, the ideally makeup should be avoided, because if you clog the pores,
Mhm.
you are going to get acne. So a mild makeup is okay, and definitely if someone has very sensitive skin, very dry skin, they should avoid makeup. So the pH of the skin is very, very important. To maintain the pH like 4.7 to 5.7, that is the slightly acidic pH, which face of the skin of the face. Uh, so to maintain that, even if you use the makeup cosmetics, that should be maintained. The moment it gets disrupted, the sebaceous glands are going to get clogged, and once that happens, you are going to get acne.
Okay, so it's a sad news for female to get makeup every
A
day.
mild makeup should do the job, but definitely never leave it overnight. whatever the scenario is, always remove the makeup after using 2 to 3 hours max.
Okay. Okay. So after the day is over, you should remove the makeup. Don't sleep with
Should
it.
remove. Never go putting my makeup in the night. Like never sleep off.
Okay, doctor, because we females like a lot of makeup to do to get so it's important to remove our makeup when we go to sleep. So, doctor, like, does family history can also cause acne? Like,
Acha, family history, there have been similarities found in the past, like twins, they get acne altogether. And like one of the parents, if a child has, so it has been seen that one of the parents also are affected with the acne. So
okay.
it has been seen similarities, but genetic pattern, it's like it cannot be established like exactly whether it is genetic disease or not.
Okay. Okay. So it is possible to find between the children and the parents, but it is not
Yes,
meant.
it has been seen. The similarities have been seen.
Okay, doctor. So, doctor, like, can like nowadays stress is something which is unavoidable. So, can stress can also cause acne?
Yeah. So the basically, uh, as I said, teenage say acne get started. So yeah, definitely hormones play a role with stress. Stress is directly related to your hormones, and hormones definitely, if they are going to get disturbed, you're going to get acne. So people with working job more than 12 hours, 4 hours. So stress is more, and nowadays that's why we see much more patients coming with very like young age, which much more acne grade 4 also. So, yeah.
Okay, doctor, very informative. This discussion was very informative. I'm sure our viewers will be benefited by it. So, doctor, can we take some live audience question, please?
Yeah, please, yeah, go ahead.
Okay, the first question from our live audience is, Doctor, I've been using a cream called Mederma to remove my scar. So, but still it is not getting light. So, what should I do?
What is it? Can you repeat the
She's,
question?
she's using Mederma as a cream to reduce the scar after acne, but it is not helping her a lot. So, what she do next?
Depends on what type of acne she has, what type of scars she has. So there are type of scars also. So there are very few type of scars which get help with the chemical peeling. So there's something called trichloroacetic acid cross. So that can help for ice pick scars. But usually the bigger scars like box scars, rolling scars, they
Mhm.
don't get affected with chemical peeling. So for those, yes, derma rolling is like, much more economical device which can help. But yeah, if person wants to fully get rid of scars, then they should go for either micro needling RF, that is called MNRF,
Mhm.
or better fractional CO2 also. I can say it has some results.
Mhm. Okay, doctor. So another question from our live audience is, uh, doctor, someone told me that skin peeling can help me reduce my scar. So is it skin peeling is effective, and what is it?
Yeah. So skin peeling is like called chemical peeling. So basically chemicals are used by professionals. So they have to visit a dermatologist for that, and to find out whether they have more of a comedones or acne grade 2, or let's say acne grade 4. So different type of chemicals are being used. So
Mhm.
salicylic acid is a good exfoliative agent. So if it's used in much higher strength, so gives very good results, but only for inflammatory acne. So if it's like more of a, let's say, pigmentation or
Mhm.
more of a erythema, then there are different chemicals for that to be used.
Okay, doctor. Another question is, hi, doctor, where can I visit you? And also, I have lot of whiteheads. What can whiteheads call the acne also in the skin?
So whiteheads and blackheads, they're like open comedones and closed comedones. So
Mhm.
they are due to excessive sebum activity. So yes, definitely start taking care of your diet, what you are eating, and can use the salicylic based combination, or different medications are there. So that can help. Salicylic based does help. Salicylic acid does help, and salicylic acid peeling also helps for that.
Mhm.
And I'm based in Gurugram Sector 56 by the name of VISH Skin Clinic.
Yes. This okay. The same viewer is asking, doctor, क्या whiteheads blackheads में बदल सकते हैं?
No, no, that does not happen.
Okay.
You
Okay.
a person can have white head and black head both, but that does not happen. That white head can become a black head.
Okay. So both are same or both are dangerous, or one is okay and one is not okay?
Both are little different. The pathology is little different of open comedone and closed comedone. So closed comedones does not have any contact with the air, and
Mhm.
while open comedones, the basically the sebum material does keeps coming out.
Mhm.
That's how they both are different.
Okay, doctor. Another question from our audience is, doctor, can you please give me some important tips for the healthy skin, like a morning and night routine?
Okay, so cleansing is very important. So do cleanse your face when you get up in the morning. So some people do need just a single cleansing, and if a person has a very oily skin, then yes, double cleansing also can be done. So can do single cleansing and use a exfoliated based face wash. And with the dry skin, yes, definitely they should avoid much cleansing. So a
Okay.
very mild face wash without any salicylic acid or any in it will do the job. And yes, after that, moisturize. Moisturization is also important. So if a person is having oily skin, they don't need a moisturizer. Depends, maybe a little or maybe more. And with dry skin, yes, they do need to moisturize to again maintain the skin pH. And yes, after moisturization, if you're going out in the sun, use a sunscreen. Or even if you're sitting on the laptop, like if you have a job for like 8 to 12 hours, you're sitting on the laptop. So that is also type of UV rays. So do use a sunscreen, a good sunscreen, maybe a zinc containing. Yeah. So
Okay.
physical sunscreens are much better. And yeah, in the night can use a moisturizer, or if depends on the age, can use some medications also if you have acne. And if higher age, much to reduce the wrinkling, can use retinol based some creams.
Okay, doctor, very informative. It's very interesting that even laptop and desktop can also lead to a skin problem. Uh, we take care of it. Another question from our viewer is, डॉक्टर क्या ऑयली स्किन भी एक्ने प्रोड्यूस कर सकती है एंड क्या ऑयली स्किन रिंकल्स जल्दी देती हैं?
Wrinkling is not related to oily skin. Wrinkling is more of a related to the elasticity of the skin. So as you age, the more and more skin become lose its elasticity. So that is how wrinkles occur. And oily skin do get people with oily skin do get a lot of pimples.
Okay. And there are ways to reduce the, the oily skin, to manage
Yeah.
oily skin. Yeah.
Face pH should be maintained. So the oily skin is also a problem, and dry skin is also a problem.
Okay. Okay, doctor. Another question is very interesting. I think all the females want to know. डॉक्टर पार्लर में बहुत सारे फेशियल्स होते हैं, तो हम क्या वो करवा सकते हैं?
I think a mild facial is okay, but yeah, do avoid any bleach or anything. So a mild facial is okay. That's what hydrofacials are now invented to deep cleanse the skin and use some medications also for that. You can use a vitamin C serum along with the facials. So
Okay.
yeah, a mild facial is okay, but avoid any bleach or any hard chemicals.
Okay, I quickly take last two questions because we are running out of time. The one viewer is asking, doctor, to lose weight, I started crash diet, and because of that, my skin is going dull, and I'm also getting a lot of pimple. So the crash diet is not good, or what should I do to lose weight?
Yeah, crash diet is never good because you are eating unhealthy, you know? And unhealthy means even if you are eating like if you are not eating fried food or anything, but your time should be maintained. So yeah, definitely, uh, if your skin is dry, then yeah, it's going to cause again pimples.
Okay,
Crash
so
diet is eating healthy and on time is very important.
okay, okay. Another question from our viewers, doctor, I've been facing diabetes, and also I have a heart problem, and I take a lot of medication for that. But somebody told me that मेरे पेट में दवाइयों के कारण गर्मी हो रही है, इसलिए मुझे पिंपल्स आ रहे हैं. तो क्या ये सच है?
Yeah, there are few medications which do cause acne. So more on the body acne, less on the face acne. Yes, definitely medications do cause acne. So if person is on the steroids or on there are few medications for diabetes also. They do cause some acne. So less on the face, more on the body, let's say.
Okay, so body acne is also there, and this type of medication acne can be managed.
Yeah,
Because what
managed.
people try to do, अरे ये medicine acne कर रही है, मैं नहीं लूंगी.
Can be managed. Time to time, they have to take the treatment, so it does get subsides.
So it
But
is must
since
visit the doctor.
they are continuously on the medications, like people on with diabetes, so yeah, they keep getting acne one or two.
Okay, doctor. Thank you so much. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
Yeah, the idea is to basically maintain the focus on the skin. If you're getting acne, do treat it. If you can not treat it, go to your dermatologist. Uh, and yeah, watch what you are eating. Diet is very important, and people with hormonal issues, they have to get tested, maybe do some blood tests, and then treat the hormones before you are treating acne.
Okay, thank you, doctor. Thank you for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. I'm sure our viewers would have found this session very helpful. Thank you, doctor. It was delight to have you, and thank you
Mona,
for your
thank you.
valuable
Yeah.
time. Thank you, doctor. Thank you, ladies and gentlemen.